If you or someone you know has recently been diagnosed with MOG antibody disease or MOGAD, then this video is for you. I know this can feel overwhelming. You might be scared, confused, or just looking for answers. So this video is here to help you understand what's happening and what to do next. So let's go through this together. So what is MOGAD? MOGAD stands for myelin oligodendrocyte glycoprotein antibody associated disease, which is a lot, so let's keep it simple. Your body's immune system is supposed to protect you, but in MOGAD it mistakenly attacks a part of your nervous system called myelin, which is the protective coating around your nerves. This attack causes inflammation in areas such as the optic nerves within your eye, which can affect vision, the spinal cord, which can affect movement and sensation, as well as the brain. MOGAD is a rare condition, and it's estimated that it affects 1 to 5 people per million every year. What are some of the common symptoms in MOGAD? Now, symptoms can vary, but here are some of the common ones that you might experience. Firstly, there are vision problems such as blurry or double vision, or sometimes temporary vision loss, which is called optic neuritis. MOGAD can also cause muscle weakness or numbness, often in the arms and legs, usually due to transverse myelitis. It can also cause confusion, balance issues, and seizures, especially in children, which is linked to a type of brain inflammation called ADEM. These symptoms can come and go. Some people just experience one attack, whereas others experience multiple, which are known as relapses. So how is MOGAD diagnosed? Diagnosis of MOGAD usually involves 3 key tools. Firstly, there is a blood test which is used to detect MOG antibodies. Secondly, there are MRI scans which are used to check for inflammation in the optic nerves, the brain, or the spine. And lastly, a lumbar puncture or spinal tap may be used to check for inflammation in the spinal fluid. Doctors also need to rule out similar conditions such as multiple sclerosis and NMOSD, which can appear similar to MOGAD but are treated very differently. What are the first steps after MOGAD diagnosis? Treatment usually starts by managing the current active attack. Firstly, steroids are given to reduce inflammation, and this can be given through an IV or cannula or as oral tablets. In severe cases, another treatment called plasma exchange may be used to reduce the amount of harmful antibodies in the blood. Another treatment called IVIG, which stands for intravenous immunoglobulin, may be used to try and calm the immune system down. Once the active episode is stopped, your doctor may recommend a long-term treatment in order to prevent future attacks. These treatments could be immunosuppressants or regular IVIG infusions. Some preventative treatments currently used to treat MOGAD are azathioprine, mycophenolate mofetil, and rituximab. So what should you do next? Firstly, join a support group so you are not alone. We have a community on Discord, and there are also non-profits who host regular support group meetings too. I'll leave a link to an article with plenty of support groups on it in the video description below. 2. Keep a symptom journal to track any changes in symptoms. Knowing what your baseline symptoms are is very important, so I recommend keeping track of them. I'll have a video coming soon about how to spot relapses, but it is very dependent on what your current state is. So make sure to track your symptoms and subscribe so that you don't miss that video. 3. Learn a bit more about the condition. There is plenty of information available here on the My Myelitis YouTube channel, as well as on our website. There are also a few non-profit organisations involved with MOGAD, and I'd highly recommend checking them out too. A great resource for those who are new to MOGAD is the MOG Project's MOG Glossary, which will translate some of the more common medical terms used in MOGAD into plain English. And 4, make sure to take care of your mental health. It's very easy to feel overwhelmed with this condition, which is why I recommend the support groups, which are very useful for helping with this. Remember that MOGAD is rare, but that you are not alone. There is a growing number of patients, doctors, and advocates all working together to help make the lives of MOGAD patients better. If you want to learn more, subscribe to this YouTube channel and I'll be sharing a lot more about what's happening in the space and how it can help you on your journey. I also share some of my own insights from living with the condition for over 5 years. If you have any questions, drop them in the comments section below and I'll be sure to answer them as soon as I can. And if you want to know more about my journey with MOGAD, then click the video here to watch the very first video in the Scott Story playlist. And I'm sure I'll be seeing you again very soon.